The patient name is Negash Legesse, 60 years. He was an Ethiopian ambassador to Australia. So 3 weeks back, he was transported from Ethiopia via an air ambulance with a history of headache, followed by loss of consciousness and weakness of the right upper and lower limbs. So when the patient came here, he was in a semi-comatose state with GCS M4VTE1 with no eye opening, and there was no spontaneous respiratory effort. And the pupils were sluggishly reacting to light. So we took a CT scan. It revealed a left parieto-occipital intracerebral bleed with a mass effect. It's a hemorrhagic stroke. So the challenges before us was that one, the patient had a massive intracerebral bleed of 9 to 6 centimeters with a gross midline shift. The second is the poor neurological status of the patient. The GCS was only M4VTE1 and on ventilator. And he also had a high INR, that is the bleeding and coagulation parameters were abnormal. So it was difficult to take him for surgery at that time. And moreover, he had an uncontrolled hypertension. The BP was around 220 by 100, something like that. And there was a history of a bullet injury in the same site, which happened about 10 to 15 years back. And also he had an HCV infection. So these were the challenges we faced in tackling this patient. So he was admitted in ICU, and 2-3 days we tried hard to control the INR and control the bleeding parameters by repeated infusions of fresh frozen plasmas and other medications to control the hypertension. We could bring down the INR to normal levels and also the BP to near normal levels. After that, we took him for surgery, and a left parieto-occipital craniotomy was done, and we evacuated there was a big hematoma of 9 into 6 centimeters. We evacuated the hematoma, and there was multiple bullet pellets were there. That also we took it out, and the parietal bone was fractured and it was driven deep inside the brain, and that also we removed. So we removed the hematoma, the bullet pellets, and the fractured bone. And after surgery, he was initially in ventilator itself, and after 2-3 days, his neurological status gradually improved. He began eye opening, and he began to move his limbs, especially the left side. He began to move the left lower limb, and eye opening was there, and the GCS also improved. So gradually, as his spontaneous respiratory effort became more, we gradually weaned him off the ventilator. And finally, and we also did a tracheostomy to decrease the chest infection. So after some time, when he got the good respiratory effort, we totally weaned him off the ventilator, and initially he was put on TP's oxygen, and finally that was also removed, and even the tracheostomy was closed. And he had a good neurological recovery, and now he can very well move his left upper and lower limb. Moreover, he started moving the right lower limb also, where the power was grade 0 initially. Now he is fully conscious and oriented. He is talking, he is very happy, and he is talking to his relatives and children, and he is happy. And by God's grace and by the team effort of the nursing staff, the ICU staff, and the ward staff, and we could achieve this good result, and everything is went fine. And today we are planning to discharge him.
First of all, I want to say Dr. Tinku and the ICU team are excellent. When my dad got here, he was in a really, really bad condition. He was in a coma, and he didn't hear or anything like that. A few days later, right after the surgery, 24 hours later, he was able to recognize his family. His recovery was very, very amazing. The ICU team are very, very excellent. They were on top of everything. Dr. Tinku always pushes my dad, to get up and then do exercise and do physio and everything. So we're very happy about the service that we received at the hospital, and we're very grateful that we're taking our dad home. So we are very happy.
Dr. Tinku is a blessing.
And I'm sure when my dad, gets better and he's back to,
normal
Previous-
old,
previous
he will definitely
Definitely
make sure
improve,
he'll
yeah.
reach out to you.
Yeah.
No doubt, he'll reach out to you. And so, but like to Dr. Tinku, and what is that the nurse's name? The
Head sister is Smita. Smita
Sister
sister. Smita. Smita sister. Then
The
Bindu.
ICU?
Bindu sister.
Bindu,
Bindu.
no, the
The fat guy. Fat
Bindu.
Bindu sister.
Yeah, Bindu, but the other
Right.
dude, the guy, the Asian guy, the Filipino.
Filipino.
Aljo.
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 Oh my God, my dad is crazy about Aljo. He loves him.
Yeah.
It's amazing. He sees him and he starts smiling. He doesn't even smile for us that much. They are great. Even you guys are awesome too. But we've been there longer,
Yeah,
so
yeah.
they were very amazing. Very
it was
like.
really in critical condition.
Yeah, they were encouraging. Every day they were
Yeah.
telling us, he's gonna walk out of here in a
Yeah.
wheelchair. Don't worry and this and
Yeah.
that. They were very supportive and
Great.
they took really good care of him.
I had a very terrible audition that get to me. Naturally, people are working hard, accepted me, and they tried to work for the people. I really appreciate that. The problem that have been for the 3-4 days, thing at least has stayed, and people are speaking about the problem, and people are looking at it. I finally am happy. Have been good enough to cover these people. And now, even though I don't have many problems, but now I can at least what is going on, what's happening on, what is the people are doing. I really appreciate for them. I think that I really appreciate for them. I really appreciate even the policemen who are working a lot to help us to the maximum. They give us everything. They try to bring their right. Second, also at least to analyze the people. The people are really interested in the reality of the country going on. So I just really praise the people, so these people. I really appreciate what they had. A lot has done good for the coming, for your next time. So I really appreciate it. Thank you very much.